Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about ICD-10 CM PCS updates 2024 first quarter part 4. In this video, we're going to cover two coding clinics. And the first one is how to code sepsis due to Staphylococcus pyogenes deep operative wound infection status post CABG. And the second one is how to code post-operative intra-abdominal abscess. So let's get started with the first one. How to code sepsis due to Staphylococcus pyogenes deep operative wound infection status post CABG. Let us see the scenario. A patient who is status post a recent CABG procedure was admitted with progressive purulent drainage from the surgical wound. The provider documented sepsis due to Staphylococcus pyogenes deep operative wound infection status post CABG. In this case, would code T81.40XA infection following a procedure unspecified initial encounter be assigned with code T81.44XA sepsis following a procedure initial encounter. Code T81.40XA does not provide any additional information regarding the depth of the surgical site infection. So the answer is, based on the documentation of deep operative wound infection, we have to assign codes T81.42XA, that is infection following a procedure deep incisional surgical site initial encounter. So instead of unspecified code, we have to assign deep incisional surgical site as per the depth. So we have to assign T81.42XA for infection following a procedure deep incisional surgical site initial encounter. After that, we have to assign T81.44XA for sepsis following a procedure initial encounter and A41.1 for sepsis due to other specified staphylococcus for the sepsis due to Staphylococcus pyogenes infected operative wound status post CABG. In this case, the provider specifically documented a post-surgical wound infection, surgical site infection. The ICD-10 CM official guidelines for coding and reporting section 1C1D5B for sepsis due to post-procedural infection states, for sepsis following a post-procedural wound surgical site infection, a code from T81.41 to T81.43 infection following a procedure or T81.49 infection following a procedure other surgical site that identifies the site of the infection should be sequenced first if known. After that, assign an additional code for sepsis following a procedure T81.44, and after that use an additional code to identify the infectious agent. So based on this guideline, we have to assign 3 codes. Now let's move to the next coding clinic. How to code post-operative intra-abdominal abscess. So let's see the scenario. The patient recently underwent a small and large bowel resection as well as excision of an enterocutaneous fistula. He presented to the emergency department and a CT showed a post-operative intra-abdominal abscess which was drained percutaneously. The provider's discharge diagnosis was post-operative intra-abdominal abscess. In the tabular list, intra-abdominal abscess following a procedure is an inclusion term at subcategory T81.43. Infection following a procedure, organ and space surgical site. So as you can see here, in the subcategory T81.43, there is an inclusion term, intra-abdominal abscess following a procedure. There is also an instructional note to use additional code to identify infection. So question is it appropriate to assign both codes, T81.43XA infection following a procedure, organ and space surgical site, initial encounter, and code K65.1 peritoneal abscess for this case? So the answer is yes, we can assign 2 codes. Assign codes T81.43XA and K65.1 for the post-procedural intra-abdominal abscess. Both codes are needed to fully capture this diagnosis. The instructional note, use additional code to identify infection, supports the assignment of code K65.1.
Please like, share and subscribe to Expert Medical Coding. Thanks for watching.